Customers drive product innovation, and smart companies listen to those customers and collaborate with them to really push the boundaries of existing functionality. That's exactly what Telemynd wanted to do as they scaled up their mental health practice. Telemynd uses CharmHealth as their EHR and Salesforce for all other patient-facing activities. Telemynd worked with Charm to improve the integration with Salesforce. So of course, I wanted to find out more. So I sat down with Roger Murray. He's the Vice President of Product and Marketing at Telemynd, and Venky Chellappa. He's the Vice President of Sales and Marketing at CharmHealth. Let's get to it. Roger, Venky, welcome to the program.
Thank you very much.
Thank you, caller. Happy to be here.
Yeah, I'm excited to sit down with both of you. You're doing some very interesting things with Salesforce and CharmHealth, which we want to dive into. But before we get there, Roger, can you introduce yourself and tell us a little bit about your organization?
Yeah, of course. I'm Roger Murray. I'm the VP of Product and Marketing at Telemynd. Telemynd is a national behavioral health practice delivering both therapy and psychiatry to thousands of people each and every day across the country.
And where are you based out of?
We're based right out of Boston.
That's amazing. Venky, can you tell us a little bit about yourself and your organization?
CharmHealth. My name is Venky Chellappa. I'm a VP of Sales and Marketing, and also I do business development. And I've been with the company from startup days. So we are a national, we are one of the top ambulatory EMR now in practice. And we offer a whole suite of solutions ranging from calendar application to all the way to the billing and the patient portal. So I think we have grown continuously 30 to 40% every year. And clients like Telemynd and Roger have been very instrumental in our growth.
Yeah, we've built this sort of relationship over the years. Telemynd was a product of acquisitions. We were really a very small startup organization that really came together around the start of COVID, and we worked with Charm really at that point to develop the solution to really work on delivering care in unprecedented times where everyone was basically in lockdown. So you had to really build out this environment to serve thousands of individuals each and every day from really a status of none. So really building out the tech, building out what the minimal viable product was to deliver that care quickly and efficiently. And then really evolving it over those years together, which is
I think we were at the right place at the right time with the telehealth, with the lockdown and the telehealth. They started consuming telehealth before this became fashionable. And COVID hit, and then they really took off, and we really took off with our Zoom. We did phenomenal growth in the last 4 or 5 years because the electronic prescription you can do from telehealth. Those two together for us for a Lollapalooza event for us, it just took us to the next level. And that's why and I think that's the reason they also stuck around, because we were getting more and more bandwidth and we were trying to support them. And these guys were growing so fast and we were offering things that was not available to anyone else yet.
Yeah, we were figuring it out together. I think most of organizations were doing it at that time where you're trying to figure these things out. Yeah, we did have brick and mortar clinics, we still do. But really the bulk of the delivery of care was being done virtually, and providing the telehealth solution through Charm, but then also looking at other solutions where we're looking at building up prescribing and maintaining continuity of care for medication management, as well as therapy and delivering care, especially for folks that are locked at home at that time, was really challenging. So it caused a large spike in the demand for mental health services, and really growing from there. And then now, post-pandemic, it's really been that continued expansion and growth where this is the new normal. This is what folks expect whenever they're looking for care now, is to be able to have a virtual component that complements them maybe going to brick and mortar as well. And that's really where now this sort of hybrid mentality has come together.
Now, Roger, you were telling me off air that you've done some pretty unique things integrating CharmHealth's EHR with Salesforce on the front end. Can you tell us a little bit more about that?
Yeah, of course. With any organization, there's always growing pains. I think with Telemynd specifically, we were looking at an enterprise level solution like Salesforce and bringing in the suite of products there that really allow us to deliver care at scale and maintaining a positive user experience for the patients and for the providers. It's really important for us. But at the end of the day, we wanted to maintain our continued relationship and integration with our EHR through Charm. So really making all of those interfaces bi-directional to where, yes, the engagement for the user is through our Salesforce environment, and the user coming in for their onboarding experience is coming through a Salesforce environment. But then that feeling like a seamless experience right into them actually delivering care and receiving care through Charm has really been the perfect complement there, both pre-care and actually delivering all the intake documents, all the other things and components that we have within Charm, but also post-care, where we're actually doing a lot of those outcomes reporting, looking at solutions to where we can engage users after or during their episodes of care, has really been the complementary tool to these two systems working from an external user looking inward. Looks and feels seamless. From our experience, we're able to integrate and keep our employees working in one platform, even though technically it's through an entire tech stack. That's really the critical component for us is, it feels inclusive and it feels like a single environment.
So it sounds like you're using Salesforce to really manage the patient side and the patient experience, the interactions there. And Charm is really meant for more the clinical side and tracking all of the notes and things like that.
All the charting, all the notes, all of the RCM components to where we're able to bill at our volume has been part of what Charm has done, and it's been very successful in doing. The Salesforce environment really complements that to where we're doing all of the user engagement. Some of the outcomes reporting and the episodes of care can be monitored through our Salesforce ecosystem. And really the provider and the patient are both maintained within Salesforce through a series of other integrations that just perfectly flow into Salesforce and then also into our Charm environment as well, to where, again, these systems, while it's a very complex tech stack of not just Salesforce and Charm, from any internal user or external user, it feels inclusive and it's one experience.
So it sounds like, again, that my journey as a patient with you may start sort of more on the Salesforce side, the intake, the acquisition, but then certain activities in Salesforce probably trigger some things to happen inside Charm and vice versa. Some events that happen in Charm then trigger events that happen in Salesforce.
We have different teams and different departments, and Telemynd has grown over the years to where a lot of different departments are really focused in different platforms. So if we have our entire finance group focused within Charm and working through their systems, it's really led to where they can remain in that system, in that environment. Anything they're doing can be applied and sent into our Salesforce ecosystem. And vice versa, we have our operations department and other groups that are working from Salesforce. All of these departments have to work cross-functionally. They all have to be aware and be able to speak to the individual, be it provider, be it patient, in a meaningful way. So keeping all those key pieces of information from how someone's doing during their episode of care to someone's validation or insurance information being updated over the time while they're in treatment, to even what a provider's doing. If they're charting and they're discharging the patient, how do we maintain their care teams and how do we maintain a clean understanding of someone's treatment duration at Telemynd?
Right.
That's really where these two systems are, for all intents and purposes. It's one, but for us, of course, I get to see all the behind the scenes of just how integrated these two things are, which is inherently always complicated.
It was a big lift actually, and Roger was single-handedly on their side. It's when people look at it, Salesforce integration, it's not a simple Salesforce. I think he started from their history is they were doing something else. He switched from some other vendor to Salesforce and then worked with us, and we put in a lot of team and resources behind it too. Some of the APIs we didn't even have it, so we have to enhance and work with this team. So it was probably 3 to 6 months we ran it.
Yeah, at least, and I think it's ongoing as well. Right. I think that's really been the benefit with Charm versus some of our other EHRs, where you're considering how much integration or how much development do we want to do? And I think that's been the real relationship building that we've had together, where even if there's a net new functionality or some new ask that we have to meet the demand for the market, we work with Charm, we develop those product solutions together, and we build out the custom API modules that we need to really bring that data in, because again, everything that Telemynd's doing, we have to do as a national practice. It has to be scalable. It has to follow regulations for our payer relationships and our each state regulation as well. So it gets very complicated very quickly, as with everything in healthcare it can be.
So, Roger, can you talk about the, like what, last May or sometime that we couldn't support you and we moved you to the enterprise server?
Yeah, I mean, that's with the growing pains of Telemynd and working through things with Charm as well. I mean, we've gotten to the point at that point last year where we were really working and we reached this threshold with Charm that, well, the volume that we're managing through all of our different departments was just too great for the way that Telemynd had started 4 years prior. So really that's where Charm stood up really an enterprise platform for us. And we were able to bring in something that can actually align with the requirements that we have with Salesforce being already an enterprise solution. Now Charm is working at that same level, and we're able to really maintain that continuity of data flow and synchronization between the platforms, which has been powerful for both reliability and ensuring redundancies to where downtime is minimized or obsolete. I think that's really been the critical component there as well.
That was a good point. Yeah, they had some issues like for a week we get probably every 30 minutes a call from Roger.
I think we take the delivery of care very important. It's very important for us. So ensuring that every patient can join their session and every provider can attend a session and have that real connection and relationship and maintaining their caseload, it's so critical. We are dealing with real mental health care, not life coaching or I would call my own first world problems. This is people that are truly seeking care for their mental health conditions. So we take the delivery of that very, very seriously. So ensuring that we have redundancies, ensuring that there is no downtime between our platforms, because we are dealing with people with higher acuity. It's so important to us to ensure that is there, and it feels inclusive and easy for the user to get their care that they need.
Just so our audience has an idea, what kind of volume are we talking about? You mentioned that you'd sort of reached the threshold. What volume are we?
I mean, just from top of mind, some of the volume that we're dealing with, we, again, annually at least, we work heavily within the military population. That's 60,000 plus hours of care being delivered each and every year just within the military population. Then you have to layer in all of our other partnerships that we're doing through Aetna, United Healthcare, a lot of our other payer relationships, which are also national. So again, just ensuring that the thousands of folks each day that come and trust us with their mental health care are able to get the care they need and that they deserve. That's really what's most important to us. And we work with Charm, and they probably hear from me more than they would care for because the response times from them is important. But also just getting whatever may have caused some disruption resolved, and building out those system stabilities were what we really wanted to focus on. And I think that's where we are today.
Roger, I wonder if you would share with us the process internally at Telemynd on how you filter all the requirements and requests that I'm sure your clinicians and folks are giving you. How do you filter that to then give it to the...
It's really complicated. I mean, it's with everything in healthcare. I think it's really been, born out of necessity. Okay. Looking at like what we've done over the years that we feel where's the biggest opportunity for success for the organization, where are the bottlenecks, and identifying really me as an executive member, but the rest of our team as well. Not being so disconnected from the end users, the employees on our departments and like what they're doing. That's really capturing the VOC from the end user perspective internally. Our patients and our providers are always providing feedback. As with any organization, you get a lot of input from everyone. Really looking at, okay, but where's the pain and like where are those bottlenecks occurring? That's creating barriers to care, be it in any of those environments or any of those users. And really that's helped us really prioritize our roadmap, not just for Telemynd, but also with Charm, and looking at what within Charm we can build to help providers chart their notes, what we can do for a patient to be able to access the information that's most critical to them, understand their own treatment goals, ensuring that they're able to understand how they're doing. I think all of those things are so critical, and the way that we continue to evolve that to ensure that patients understand that, naturally dealing with your mental health care, it's uncomfortable. Nobody wants to unpack their trauma. So using some of the outcomes reporting and all of the data that we've done with Charm, now we're able to really evolve that to encourage users and patients to continue going. Like we know it's going to be uncomfortable. We're unpacking things, But keep at it, because you've improved from your baseline to now by X percentage. So let's keep going together. Or, encouraging them that, maybe it's time for them to book their next session based on something that they've done throughout those assessments, to say, looks like you may need some new coping tools to deal with your mental health condition. Let's look at booking your next appointment. And then again, that's where the human interface comes in, where our care team takes care of those users and really matches them with a new provider. And we move that through the process through Charm as well.
And how do you Venky, take the requirements from the team at Telemynd
The way I was going, like we have for how many years we are doing almost weekly check-ins with them. We have weekly meetings, a technical team. They were meeting, one guy from Zoom, a couple of guys here. So we have a project manager, manages the whole project. There's like a running list. So we work with them on the security side. We work with them on the product enhancements, usability, API. So multifaceted approach. So we bring the whole team. So the project is managed centrally, and then pretty much that project manager reports to Roger and Telemynd team. So, and that's the way we set it up, so that it's a continuous, so that they don't get frustrated. Also, they need to know what is out there. So by coming every week, by taking their inputs as well as their issues, then we'll also know where our roadmaps are. Can we push something forward, or can we push it out something, so we can prioritize based on what they want. So it's a learning experience for us, but at the same time, we made a commitment to Roger and his team that we will support them. And that's why we moved them to, as I said, to the enterprise class and put in a lot more resources. And because at the end of the day, if they are successful, we are going to be successful. And that's why it gives us confidence to move into the enterprise. Okay, we can get there.
And I think that's been very valuable for us, the team being really the same users that have understood Telemynd's growth. We've grown together. And these same engineering teams that have been with Charm, that have been working with Telemynd over the years, they understand our business. Like, as I think he was just saying, I left one meeting with engineering, went through the process, and we worked through the next roadmap of like what's to come and some of the exciting things that we're going to be building together. I don't know if there's many organizations that would work and really be a true partner like that with Telemynd. I mean, I work with many parts of our tech stack, and I can say that the receptiveness to develop and grow together has been invaluable for us.
And a lot of what you've built for Telemynd, has that now become just part of the product now?
A lot of them inside will be inside, but the APIs, they're very sophisticated in a way. I think it's their whole stack is very sophisticated, supply demand matching, all kinds of things they do. So inside, whatever we do, some enhancements, everyone can see it. So, but with the APIs, whatever they do is their secret sauce.
That's the way it is. Excellent. So what's next for Telemynd? What are some of the things maybe you're working on that you're collaborating with CharmHealth on?
Yeah, I think some of the most exciting things that we're really focused on now is really giving transparency to the patient and to our payer partners to say, not only are we just delivering care to patients each and every day, but also we're helping them. And here's how we're helping them. Here's how well they're doing. And putting that in both aggregate form for our payers to understand that we are moving our patients forward to prevent them from having to go to the emergency room, to help users understand their own treatment goals and how well they're doing over time. Those are some of the biggest aspects of what we're focused on right now. It's also extending the opportunity for users to deliver care or receive care, not just through telehealth, but also through telephonic means, because these users, sometimes, life gets in the way. Like they can't always be on camera for some of their sessions. So yes, maybe they want to join telephonically for this one appointment because they have life that happens. I think those are some of the things that we're working on now. But I do think the biggest thing that we're focused on is really this sort of outcomes aspect, because really building journeys and experiences for everyone to understand how we're doing and how they're doing, both on the provider perspective to see, here's your caseload, here's how well you've been treating your patients, or for the patient to understand how well they're doing, or our payers to understand for all of the programs you're spinning up for them, for child and adolescent or first responders, or for the military population or the VA. How are each one of these unique segments of our population that we're treating, how well are we treating them? And how quickly are they getting to their appointment? And how long are their treatment durations and when do they return? Like those are all the aspects that we're doing now together. And I think that's been...
So that's a very critical point, because when they started, these were all not in the roadmap. So as they get more and more comfortable, the business growing, they started asking for a lot more granularity there, that now they want the times, how many. So it's a lot of information they are getting from their system as well as our system, and they're building a very beautiful analytical tool.
Yeah.
So I think that's one of the things is how many minutes they are spending, how many no-shows, all kinds of things, they now get those information.
Yeah, I think the true journey building experience, which is so critical, and it's going to be the most powerful tool that I feel that is the next big thing that we're releasing. And really, it's not even our own idea. This is really the requirements of like how telehealth is moving forward as a national solution to the barrier to care.
Right.
I think that that's where every payer wants to understand how well are you doing, and then are you actually helping people? So this is born out of necessity, and it's something that, again, Charm has been really great in working with us over the last year to evolve, and I'm really excited to see that go into production.
It seems like there's a lot of valuable data that's in the journey itself.
Absolutely.
You're talking about the minutes, the no-shows. All these can be clues as to how receptive or how far someone is really taking their care. And it also sounds like, Roger, you're talking about more than just tracking, their X way through the allotted number of hours. You're actually talking about real outcomes. How are they doing relative
real
to
outcomes,
their peers? And
real reminders for folks that, they may be uncomfortable with what they're doing. So, or talking about, so let's help them. Like, we know it's going to be tough, but let's go ahead and book that next follow-up because it's overdue. And, looking at the assessments of like how well they're doing as well. I think, again, that is encouraging them without just the standard fare reminder that you get from every technology, like my dentist appointments and things. Like, yes, great, thank you. I know I'm due for my teeth cleaning. I think that, working through, yes, not only are you're due for your next therapy session, but also like, this is what your last one was like and how far in the progress you've done through your treatment goals you are in, or where you are. I think that's really been the value and the powerful assets that this will be able to allow us to do.
positive reinforcement always works.
Absolutely, yeah.
Right. But again, coming back, tech stack does not solve the problem. People solve the problem, right? So that's we have tech stack, they have tech stack, but I think the relationship we build together, I think he's more comfortable with us now, and he's part of our team, and we consider Telemynd as a part of our team now because we know what's going on with them, and they get prioritized. And there's as he said, there's a consistent team in place, so it's not like he doesn't have to teach us anything. No continuity issues.
There's no doubt. It sounds like you guys have a very collaborative relationship. Maybe I'll ask this final question of both of you. Roger, what advice would you give to someone who may be listening or watching this, who's at a practice and who wants to have a good relationship with their technology vendor? What would you tell them to do?
That's a tough one, but I think, and I think this goes for Charm and it also goes with other environments. I always try to ground my requests or ground the product development requests through how does this not just fit the needs of Telemynd, which could be self-serving and a bit selfish, but how does it work actually for the broader product and what the software is actually delivering? So this application may be successful or meaningful for Telemynd, but also this is how it applies to everything in healthcare and how every practice or everyone in this sector operates. So really giving that context, it not just builds a better relationship and a partnership through our software solutions, but also it helps the engineering team and the developers to understand, it gives them the power to think over and above the scope of work, to come up with their own ideas and to actually bounce an idea back, because I certainly am not someone that knows everything, and I will forget things. So that's really, really where that's been successful is, yes, you build that true partnership, you build that relationship with those users that are actually developing the work for you to make you look good. But also giving that context, you give that full scope and understanding of what you're building and the why, I think has been the aspect that has really led to success for anyone that's looking to build anything. And also really ground yourself on like the minimal viable product for everything. The world of perfection is very hard to overcome. So really what you can do to release and then evolve and enhance over the time, because that's always, I don't think many people have the luxury of building to perfection.
Right.
We're all asked to do things in very tight timelines. So those are the tips that I would give.
And you, Venky, the reverse question, what piece of advice would you give to someone listening and watching this who's maybe at a vendor who wants to have a very collaborative relationship with one of their clients?
I would say the first piece is the discovery process. Don't rush. I think sometimes bigger clients, they come in and they set of features, or this can you do, and then our sales guys also has a tendency, oh, we can do this. And we jump into this, and then we go too far, and then we find out that we didn't establish what is their goal, long-term goal, what is it. So I think a good discovery process, and even just a sketch out, like, okay, I want Charm to do this, I'm going to do this one. And so we need to have an open discussion. So then we know, okay, what is our lift is going to be, what are they committing? Mm-hmm. So it kind of builds us the process. And in that process, we can also gauge their interest. We can also learn from them how much resource we need to put in. I think that's what we are trying to focus on. And that's why one of the main things I try to do is with the discovery process, the churn is very low and very happy customer, because they feel that this guy talked to us before. If they know what are the limitations of the software, they're happy with it. And also good customers like them, they're good for the business, because they're going to say good things about you. And so our NPS is very high. Whenever we did the NPS score, we are always high, because if you look at it, most of the smaller practices, they all come from, Dr. Johnson referred me, Dr. Smith. Then, because they are using Charm, and then someone asked them, okay, just sign up with them and I'll teach you, or something like that. So that's where, right now only we started spending some money on marketing. Before that, it's a lot of word of mouth. And that's what we like about it.
Well, both of you shared a lot of great information with us. Roger, where can people go to learn more about Telemynd?
Absolutely. So you can always visit telemynd.com. It's telemynd.com. Always feel free to explore it there, any of our social channels, or of course, reach out to us live if you're requesting care. We have a care team standing by.
And Venky, where can people go to learn more about CharmHealth?
CharmHealth.com, and you can go there, and there's a chat box. You can ask any questions. Our support guys will direct you to the right people.
Amazing. Well, both of you, thank you so much for being on the program today. It was really great having you.
Thank you. Thank you, Colin. Appreciate your time.
Hey, I want to thank Roger and Venky for sharing their insights with me. It was really interesting to hear how Charm and Telemynd are both evolving their businesses together. That's exactly the kind of partnership that I think we all want to have with vendors that we choose to work with. And hey, if you enjoyed this interview, please like and subscribe. Also, head on over to healthcareitttoday.com, where you can find more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next video.